Hello and welcome. I'm Dr. Olivia Parker, a urologist, and for more than 12 years I've worked closely with men over 60 who want to stay strong, confident, and healthy without shame, confusion, or dependency on pills. I want to begin with a conversation that has stayed with me for years. A 72-year-old man once sat across from me in my clinic. He looked healthy. He wasn't sick. He wasn't on any new medication. Yet he leaned forward and said quietly, "Doctor, I've been doing things the same way for over 50 years, but lately something feels wrong." What surprised him, and what surprises many men, is that the problem wasn't aging itself. It wasn't disease. It was a habit he had been repeating on autopilot for decades without realizing his body had changed. What was slowly affecting his heart health, his prostate, his circulation, and even his ability to feel pleasure wasn't the act of masturbation itself. It was how he was doing it. And like so many older men, no one had ever explained to him that the body after 60 needs a different kind of care. Masturbation can absolutely be healthy. When done correctly, it reduces stress, improves mood, supports prostate health, and maintains circulation. But when older habits don't evolve with an aging nervous system and changing hormones, those same habits can quietly become harmful without a single warning sign. After 60, your body speaks more softly. It no longer tolerates excess tension, overstimulation, or force the way it once did. Continuing to do things the old way can drain energy, dull sensation, weaken erections, and even affect long-term health. Today, I want to share the most common masturbation mistakes I see in older men, and more importantly, how to correct them before they impact your well-being. One of these mistakes is so common that nearly every man I meet gets it wrong at first. Before we continue, take a moment to subscribe and turn on notifications if you value clear, practical medical guidance designed specifically for men over 60. I share insights every week based on real clinical experience, not internet myths. And in the comments, tell me where you're watching from. This community spans the globe, and I truly enjoy hearing from you. One of the biggest mistakes older men make is relying almost entirely on visual stimulation. Over the years, countless men in their late 60s and 70s have told me the same thing. "Doctor, I can still function, but I don't really feel much anymore." They assume it's age? It's not. It's overstimulation. After 60, the brain's dopamine system becomes less flexible. Dopamine is responsible for pleasure, motivation, and satisfaction. When it's constantly flooded with high-intensity visual novelty, the brain adapts by numbing itself. Clip after clip, endless novelty, artificial stimulation at levels the brain was never designed to handle. Over time, real touch feels dull. Intimacy feels distant. Pleasure becomes mechanical. This isn't weakness. It's dopamine fatigue. The brain's way of saying it needs rest. Many men are shocked when sensation begins to return simply by stepping away from visual overload and reconnecting with natural arousal through touch, breath, imagination, and presence. Another surprisingly harmful habit is masturbating while sitting on the toilet. It feels private and convenient, but biologically, it's damaging. That hunched, compressed posture restricts blood flow to the pelvic region. After 60, circulation is everything. Blood flow supports erection quality, prostate health, bladder control, and nerve sensitivity. Sitting for long periods in that position compresses arteries and nerves. Over time, it contributes to pelvic tension, weak urinary flow, dribbling after urination, and chronic discomfort. The pelvic region needs space and relaxation, not pressure and constriction. Simply changing position can dramatically improve comfort and circulation. Rushing the experience is another silent mistake. Many older men treat self-pleasure like a task to be completed quickly. When you rush, your nervous system shifts into tension. Heart rate spikes, blood vessels constrict. The body never enters the calm, restorative state that releases oxytocin and other healing hormones. You may climax, but instead of feeling satisfied, you feel drained or empty. Over time, this rewires the brain so pleasure becomes shallow and disconnected. Slowing down allows the nervous system to relax, improves blood flow, and restores depth of sensation. At this stage of life, there is no urgency. There is only renewal. Another overlooked factor is the pelvic floor. Most men are never taught about it, yet it plays a central role in erection strength, bladder control, ejaculation, and confidence. When the pelvic floor weakens, everything above it suffers. Many men unknowingly strain or ignore these muscles during arousal, which worsens weakness over time. This contributes to reduced sensation, weaker erections, and urinary issues. Gentle activation of the pelvic floor, the same muscles used to stop urine midstream, improves circulation, strengthens nerve pathways, and restores control when practiced consistently. Frequency is another area where extremes cause harm. Too often, and the prostate becomes irritated while energy levels drop. Too infrequent and circulation stagnates, nerves dull, and sensitivity fades. The body thrives on rhythm. For most men over 60, 1 to 2 times per week, done mindfully, maintains hormonal balance, supports prostate health, and preserves vitality. This isn't about strict rules, it's about listening to your body and respecting its signals. One of the most damaging mistakes, and the one almost every man gets wrong, is using too much pressure or force. As sensitivity decreases with age, the instinct is to grip tighter or press harder. Unfortunately, this does the opposite of what men want. Excess pressure damages delicate nerves, causes microtrauma, reduces elasticity, and can even contribute to curvature over time. Force does not restore feeling. Gentleness does. The body responds to patience, not punishment. Quality of touch matters far more than intensity. The final mistake is emotional disconnection. Over time, many men lose intention during self-pleasure. It becomes routine, silent, and empty. When emotion is absent, the brain stops releasing oxytocin, the hormone responsible for connection and emotional well-being. You may climax but feel hollow afterward. This isn't age, it's disconnection. Even solo touch can be grounding and restorative when done with awareness. When intention, gratitude, and breath are present, the nervous system responds in powerful ways medicine cannot fully measure. When you bring all of this together, the path forward becomes clear. Reduce visual overstimulation and return to sensation. Choose positions that support circulation. Slow down and let relaxation lead. Engage the pelvic floor gently. Find a healthy rhythm that suits your body. Use soft, patient touch. Most importantly, reconnect emotionally with yourself. Aging does not mean decline. It means refinement. I want to speak to you not just as a physician, but as a woman who has spent over a decade listening to good men struggle silently. You are not broken. You are not past your prime. Your body is simply asking for a different kind of attention, one rooted in awareness rather than habit. When you respond to that request, confidence returns, pleasure deepens, and vitality feels alive again. If this message resonated with you, please like this video and share it with someone who needs to hear it. And don't forget to subscribe for weekly insights designed to help you live stronger, healthier, and more connected at any age. I'm Dr. Olivia Parker, and your best years are not behind you. They are shaped by how you care for yourself right now.